Antibiotic resistance is a growing global health concern. It refers to the ability of bacteria or other microorganisms to resist the effects of antibiotics, rendering these medications less effective or completely ineffective in treating infections. Causes of antibiotic resistance. Misuse and overuse of antibiotics in human medicine, such as inappropriate prescribing, not completing the full course of treatment, or using antibiotics for viral infections. Overuse of antibiotics in livestock farming and agriculture, including prophylactic use and growth promotion. Poor infection control practices in healthcare settings, leading to the spread of resistant bacteria. Global travel, allowing resistant bacteria to spread across borders. Lack of development of new antibiotics, leading to the over-reliance on existing drugs. Impact and consequences. Increased morbidity and mortality. Infections caused by antibiotic-resistant bacteria are more difficult to treat and can result in prolonged illness, increased hospitalization, and higher mortality rates. Increased healthcare costs. Treating antibiotic-resistant infections often requires more expensive drugs, longer hospital stays, and additional medical interventions, leading to higher healthcare costs. Limited treatment options. As antibiotic resistance continues to rise, the number of effective antibiotics diminishes, leaving patients with fewer treatment options for serious infections. Compromised healthcare procedures. Antibiotic resistance can impact various medical procedures, such as surgeries, chemotherapy, and organ transplantation, where the risk of infections becomes higher. Combating antibiotic resistance. Improving antibiotic stewardship. Promoting appropriate antibiotic use, ensuring proper prescribing practices, and educating healthcare professionals and the public about the responsible use of antibiotics. Enhancing infection prevention and control. Implementing strict hygiene practices in healthcare settings, promoting hand hygiene, and adhering to infection control guidelines to prevent the spread of resistant bacteria. Developing new antibiotics. Encouraging research and development of novel antibiotics and alternative treatments to combat antibiotic-resistant infections. Promoting surveillance and monitoring. Establishing robust surveillance systems to monitor antibiotic resistance patterns, identify emerging resistance, and guide treatment strategies. Global initiatives and policies. World Health Organization, WHO. The WHO provides leadership and guidance in addressing antibiotic resistance, promoting awareness, and coordinating global efforts. National action plans. Many countries have developed national strategies and action plans to tackle antibiotic resistance, focusing on surveillance, research, education, and regulatory measures. International collaborations. Organizations and initiatives, such as the Global Antimicrobial Resistance Surveillance System, GLASS, and the Global Antibiotic Research and Development Partnership, GARDP, foster international cooperation and research to combat antibiotic resistance. It is crucial to address antibiotic resistance comprehensively through a multidisciplinary approach involving healthcare professionals, policymakers, researchers, and the public. By promoting responsible antibiotic use, implementing infection control measures, and fostering innovation, we can work towards preserving the effectiveness of antibiotics and mitigating the threat of antibiotic resistance.